Alright, I have an order to give furosemide 20 milligrams IV push every 8 hours, and I've used this label below to calculate the rate and volume of administration. So I'm given 20 milligrams, and my vial contains 100 milligrams per 10 milliliters. So after I did my math problem, I'm given 2 milliliters over 1 minute. Alright, so I'm going to check it to my MAR. I have the patient John Smith, whose birthday is 3/23/91. That's the same, and he has no known allergies, and 20 milligrams of furosemide IV push. So everything matches my MAR compared to my order. Now I'm going to come look in the book to see what a safe dose is. For edema, which is what we're giving it for, is 20 to 40 milligrams, so we have a safe dose. It can be given undiluted, but it is compatible with the D5W, which is what we have running. You're going to give, for IV push, each 40 milligrams over 1 to 2 minutes. So you would give 40 milligrams over 2 minutes. Since I'm given 20 milligrams, I'm going to give that over 1 minute. So I'm going to push 1 milliliter over 30 seconds, and then the other over another 30. Some contraindications could be anuria, hypersensitivity to furosemide. Some precautions: it causes excessive diuresis, which causes dehydration, and blood volume reduction with circulatory collapse. It can possibly cause vascular thrombus and embolism, but that mostly happens in your elderly. You need to monitor their blood pressure frequently, especially at the beginning of the therapy. You need to monitor their electrolytes because it can cause hyponatremia, hypokalemia, hypomagnesemia, and hypocalcemia. So before you give this and after you give it, you need to make sure you're checking those electrolytes. Some side effects that can occur are tinnitus, constipation, cramping, diarrhea, dizziness, or anorexia, and blurred vision. Those are just some of the more common side effects. So I'm going to make sure to tell my patient to look for that and report any of them. So now I'm going to go prepare my medication, hand hygiene. I'm going to take my MAR and compare it to my vial, which I have furosemide, 10 milligrams per milliliter. So it matches my MAR, and I'm going to draw up 2 milliliters. Let me check the expiration date. It expires June of 2021, so we are good with that. So now I'm going to get ready to draw it up. Alright, so I have my 2 milliliters of air. I'm going to clean the top for 30 seconds. I'm getting ready to prepare my medication. I'm going to wash my hands. Okay, grab my bottle and clean it. I'm going to clean it for 30 seconds and let it dry 30. Okay. So that was 30 seconds. Go ahead and throw that away. Alright, so while that's drying, I have my 2 milliliters of air, and I'm going to get ready to inject that in here. So I worked out my problem, and draw that 2 milliliters. Give my patient 2 mLs of furosemide. So I'm pulling back 2. I'm going to inject air into my vial. Make sure there's no air bubbles. Okay, so I have pulled up 2 milliliters. Now I'm going to scoop this cap back on, and I'm going to prepare the label. So my patient is John Smith. I'm getting furosemide. 20 milligrams. Prepared on September 23rd at 10:35. Expiration date and the time that I'm going to be using. It expired June of 2021 at label done. Now I'm going to go into my patient's room, do hand hygiene. I put my medication to the side while I identify the patient. Can you please tell me your name and date of birth? He tells me his name is John Smith. His birthday is on March 23rd, 1991. Do you have any allergies, Mr. Smith? He doesn't have any allergies. I'm going to check your IV out real quick before we give you some medicine. His IV is intact. We'll check for blood return. So he has good blood return. So his IV is working good. Alright, now I'm going to take one more and compare it. Make sure I have the right medication, the right patient. John Smith, furosemide 20 milligrams. Okay, so it matches my MAR. Now I'm going to go to administer it. And since it's not in an INT, we don't have to wear gloves. So I'm going to clean the port closest to his IV. So I'm going to clean this for 30 seconds.
And 1 ml every minute. So I'm going to be clamping the tubing closest to the bag. So I'm going to clean.
While I'm cleaning this, I'm going to tell him that I'm giving you furosemide. It is for the swelling that you have, and it is going to help get rid of that and get rid of some fluid on you. So it is going to make you urinate a lot, and I'm going to be monitoring you for a few hours after. So after I clean that, I'm going to push. I'm going to push 1 milliliter over 30 seconds. So I'm going to clamp. Alright, so I'm going to push 1 whole milliliter with my line clamped. So I have my milliliter push. Now I'm going to unclamp for 30 seconds. Okay, now I'm going to clamp the line again and push the last milliliter. And unclamp for 30 more seconds. Okay, so we have pushed furosemide over 1 minute, so now I'm going to put all this in the sharps. Now I'm going to tell Mr. Smith, now let me know if you feel any dizziness or you get a headache, and please let us know if you need to use the restroom so we can help you get up, and if you start feeling any type of weirdness or you don't feel the same, you need to let us know. So I am going to leave my patient safe with his bedside rails up, bed load, and wheels off.